Good hygiene is the most effective way to combat infectious diseases such as COVID-19, as well as the flu. It mirrors the old adage that prevention is better than cure. Today, we'll learn more benefits of practicing good hygiene and its overall effects on our mental health. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. Our guests are here today to discuss the importance of hygiene. With us is Dr. Aika Buenavista. She's a lifestyle medicine specialist from Signature Medical Concierge. Also joining us is AJ Sung Lao. He's a psychologist from Mind Plus by Life Science. Good hygiene involves a lot of self-discipline. If there's one silver lining that this past pandemic has brought about, was that increased consciousness on good hygiene. I'll start the discussion with Dr. Aika. Please explain to our audience, what exactly are we trying to achieve here by having the habit of good hygiene?
First of all, it's really important that we do practice good hygiene in order to help us keep our bodies healthy and clean. It's not only good for our physical health, but also our mental well-being, right? And we're not only helping ourselves, but also the people around us because we prevent illnesses in the first place. Aesthetically wise, we feel good about ourselves, about our appearance. And in a social level, usually we would avoid people with poor personal hygiene because of body odor. And thus, this can result to isolation and loneliness. So as you can see, our hygiene impacts our overall well-being.
AJ, is having good or bad hygiene a sign that there is probably some behavioral problem involved here? Because we have to also understand that hygiene is somewhat culturally related. The hygiene that we're used to here in the Philippines may be different in other parts of the world. What can you say about that?
It's really cultured. How far are we acting relative to what we're used to in our culture? And malaking bagay nga sa Pilipinas, lalo nga na ang, let's say, pagligo araw-araw, brushing your teeth every day. So these basic things. And if we're having poor hygiene, we're really going away from that norm, which could be a sign of many things. Again, in the pandemic, the extreme has really been doing it too much. While, very common din for people struggling with their mental health na not let go nila to.
When it comes to mental health, AJ, what are some of the red flags? Kumbaga, ano yung cut-off ng level of hygiene ng isang tao dito sa Philippines to be considered, kumbaga, mentally healthy?
Yung pinakamadaling may is how much is it disrupting our day-to-day lives? Na-mention nga kanina na, for example, nahiya tayo lumabas ng bahay dahil nga we're not being hygienic, or we're not feeling clean, or we're getting sick, we're getting very common issues na could be solved by good hygiene. Let's say gum problems or nag-breakout skin natin dahil nga di tayo naliligo. So these are things that could already be signs that we might be dealing with something, a mental illness now or severe symptoms of one.
Now, I'll go back to Dr. Aika. When it comes to basic hygiene, what is considered basic?
Okay, actually, we do have different types of hygiene. So first, for example, your dental hygiene. Another type of hygiene is your hand hygiene. And another type of hygiene is, of course, our nails. And of course, we have toilet hygiene, properly disposing tissues that we use, especially if you have an infection. You don't want to spread it within the home. Okay, so we have to practice that proper etiquette inside the toilet.
Pandemic-induced anxiety is a real thing and may have also made some people who have been working at home more anxious and have these certain feelings, especially when it comes to contacting diseases, maybe germs. Now, AJ, let's talk about that for a minute. Is it normal to still be anxious nowadays na ma-infect or makapitan ng germs or kumbaga takot lumabas because baka mahawa ako ng COVID?
Now we've seen it nga over how the pandemic goes. I think that shows really it's okay to be anxious about COVID. I think that's a normal state talaga because it's an illness. Even if you're vaccinated, we still don't want to get sick. But really what we're seeing over the growing COVID anxiety and growing health anxiety is really habits and mga behaviors na lagpas na talaga doon we're in. We've had people not go out at all for years. And as the economy is opening up, more and more people are trying to meet face to face. Sometimes it could also limit the kind of opportunities that we get. We're also seeing people that, as you mentioned, like, are still hoarding, let's say, cleaning supplies. They're still hoarding alcohol, and it's really become to the point it's debilitating na.
That's correct. But the question now is, how does that affect your overall mental health? Because this pandemic has made it uneasy for those who struggle with a condition called germophobia. Now, germophobia is the fear of germs. And in this case, germs refer broadly to any microorganism that causes disease. For instance, bacteria, viruses, or even parasites. Now, AJ, can you please tell us more about this fear of microbes in general? What causes a person to be considered a germaphobe?
COVID is a perfect example because the entire environment became hostile to you. And we know it's a virus, we know you can get it. Early in the pandemic, the belief was you can get it from surfaces. Nga. That's why we were cleaning everything or having UV everything. The thresholds here is, as I mentioned kanina with bad hygiene, na how much of it is disrupting your day-to-day life na? Is it really affecting you in a way that makes relationships harder, that gives you, going outside, you're already feeling anxious, that just thinking about it makes it scary for you? These symptoms that onting isip mo pa lang may anxiety na, and this could be triggered by things, again, over the pandemic, say trauma, like nagkasakit kayo or someone in the family, just the overall overwhelmingness of the news in the surges of the pandemic could also trigger this.
Now, Dr. Aika, it's a good thing that a lot of people are more hygienic conscious nowadays, but is there a right or wrong way to actually be hygienic?
The thing about that, it can lead to health risks. Okay, so this can be so persistent that it would affect our day-to-day life to the point that they would fear going out, just eating in a restaurant, or even doing sexual relationships with their partners. They fear going out to places that have a lot of germs, like public bathrooms, public transportation. They don't even go to school, to work. They are scared of touching doorknobs or shaking hands with somebody they just met. And it can also lead to a disorder called OCD, obsessive compulsive disorder, where we see patients would have to wash their hands 10 times after they eat, or they would have to shower 10 times in a day, or clean a surface 20 times. So as you can see, it's a dramatic response that is not necessary. Plus, it is time consuming. So the whole day, they're just cleaning and they don't do anything else but just clean. They cannot work. They cannot do their school task as well. They can even take care of themselves or even their children if they're parents. And so as you can see, it's affecting the overall well-being of a person.
When we come back, we'll discuss what happens when you practice good hygiene but still experience body odor. We'll be right back here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. We've been discussing proper hygiene and some of the effects, but what happens if even though you practice good hygiene, you still notice a sense of body odor lingering on yourself? Now, Dr. Aika, when it comes to body odor, how is this produced? A lot of people will note, obviously, body odor by this aroma in themselves. What causes this? Let's dive deep into the cause of this.
Yes, so for body odor, it's not just about the hygienic practices of a person, but it's a mix also of our sweat glands, how it activates in our body, as well as bacteria. So it can also change because of our hormones, especially if there's hormonal imbalance, even the food that we eat, okay, certain infections that we might have already, medications that we are drinking, and other underlying conditions like diabetes. So they can also have body odor as a complications.
Dr. Aika, you bring up some very good points there. Now, let's tackle them a little bit more specifically here. When it comes to, you mentioned glandular problems, maybe the sweat glands. What is happening here? Anong nangyayari? Bakit nagkakaroon ng body odor?
So the first thing, of course, when it especially is a bit smelly, doctors would have to investigate further, especially trying to check if a patient has diabetes, gout, menopause, or undergoing menopause, if they have a very hyperactive thyroid, or they have a liver problem as well as a kidney problem, and even other infectious disease. It can, of course, be due to hormonal changes. So, for example, for those who are undergoing menopause, they have hot flushes. For women, okay, it is expected that during ovulation in their menstrual cycle, the body's odor also changes. So that's a normal occurrence in females.
Now, Dr. Aika, how about when it comes to certain foods? What component in that food creates a reaction in the body that may promote hypersecretion of the glands and then thus cause some body odor?
Yeah, so some foods actually have a high amount of sulfur, and sulfur is the one that causes that a bit of rotten smell, and they can be obtained from onions, garlic, cabbage, broccoli, cauliflower, and red meat. We also sometimes use spices, right, to give taste to the food, like, for example, MSG. Even spices like curry can give that certain odor, and hot sauces as well.
Now, AJ, as discussed by Dr. Aika, there are several things that may cause body odor that are beyond the control of the individual. Now, let's discuss that. How does this affect? Because kahit na they're practicing good hygiene, they have good hygiene habits, meron pa rin talagang smell. And it can affect them in both their relationships. As we mentioned earlier, it may be culturally unacceptable in certain areas. What effect can this happen to the individual?
The first year is really frustration. Na imagine I'm doing everything I need to, I'm doing it well, but it's still happening, still being, I still notice a body odor from me, so that can cause frustration. On a more social level though, yun nga, there could be baka ma-ostracize ka or mabully ka. Children are susceptible to this, especially some kids don't really know how these things happen, especially again in puberty where these kinds of perceptions are matter. Na, oh, pagka may BO ka, as what people call it, it could lead to people to bully you, to make fun of you. As an adult, there's a lot of shame. Now, might want you to recess a bit, might want you to, ay, kasi lumabas ako because I'm ashamed of my body odor.
How should parents approach this then? Should they reinforce the security of the child, or should the parents try really and find ways on how to manage that odor to fit in the society that they're in?
I think, of course, the number one thing your parents should really do is, of course, make sure they know the cause. Now, as Dr. Aika mentioned earlier, body odor, especially with good hygiene, might be caused from an infection or certain diseases. So number one, let's make sure that's not it. But on specifically just the child, of course, one thing is really to communicate to the child that often it's not them, right? Children can be mean, certain individuals can be cruel, and that's something that's outside of our control. Like we can't really control how they react, but then we can prepare the child to be able to manage certain how they respond to those kinds of, let's say, bullying, those kinds of actions. At the same time, hopefully, so in a school, we also talk to the teachers or talk to the administrator to make sure that at least we prevent them.
AJ mentioned how important it is to find the reason for that body odor and to address that. Let's talk about addressing that. If someone has BO because of hyperactive sweat gland, what type of treatments are usually used to manage this?
So first of all, if you do have body odor, it's best to consult your doctor first. I know there are a lot of information online that would be sold as home remedies, but of course, remember that this also is treated by medications and procedures. Like for example, we do small injections of Botox in the armpit. There are also some prescription medications that we give to patients, even antibiotics, especially if it is bacterial in nature. Some even would have very severe conditions that would need surgery. So we also have to dive into the personal hygiene of the patient, which we do as lifestyle medicine physicians, even focusing on the stress level of a person, because remember, as I mentioned a while ago, that odors can also stem from the stress level of a patient.
Now, coming up, we'll give you tips on how to practice better hygiene, only here on MedTalk Health Talk. Dr. Freddy Gomez, and this is Med Talk Health Talk, where your care always comes first. Now, we've been talking about good hygiene and habits to establish in order to continue to practice good hygiene. With that in mind, Dr. Aika, what are some tips that you could share with our viewers in trying to practice good hygiene? In essential good hygiene tips, let's start with taking a bath. Is the type of soap important pag naliligo ang isang tao? And is there a certain time limit na dapat? Because we all know when it comes to brushing our teeth or washing our hands, there has to be some level naman of time for you to have those effects of good hygiene. When it comes to bathing, what are some tips that you could share with the viewers?
It would depend on the skin concern of course, of the patient. So for example, if they do have a fungal infection, we would prescribe fungal soaps. If the patient has sensitive skin, of course, we would prescribe very hypoallergenic skin soaps in the first for the body. And with regards to the timing, of course, for example, for brushing your teeth, at least 2 minutes is already enough, as long as it is done properly in a circular manner. And of course, they do have to floss every day, at least before going to sleep. With regards to hand washing, you would also want to use any soap is fine as long as it's mild soap within the 5-step recommendation of course, WHO. Again, washing your hands under running water and then making sure that the soap would bubble or lather, rubbing them on the back of your hands, between your fingers and underneath your nails.
Now, AJ, with all of this, all the tips in mind, what can you advise our viewers who are still anxious to go out, who are still anxious because the pandemic is still with us? That is still a reality, and it causes that level of anxiety. It affects their work, it affects their performance. What advice can you give them?
I think the number one advice really is, of course, let's check our habits again. Dahil because of how long the pandemic has been, we've really kind of normalized our habits in the pandemic mindset. But as we now go outside of this, as again, the economy opens up, we're able to go out, we can start recreating habits again that kind of normalizes our lives in this space. So it could be something like going out with friends. We could schedule that from that online meetups. Now we can do it face-to-face. These are things that we don't have to do alone. I think that's also an important reminder. We could have family members, like say, go out to an open park where we feel it's safer, or go out in places with good health protocols in place. So we don't have to suddenly go out and all in tayo agad. We can do it step by step as we try to, again, kind of reacclimate ourselves to the world.
For those who are still unsure about their current mental health, especially now that the pandemic is hopefully on the tail end, is this something that they should try and internalize? Is it okay for them to talk to mental health specialists such as psychologists or even psychiatrists, even counselors? Where can they go?
Number one, I think what we always tell people is there's no wrong time to seek professional help. You don't have to be at the brink, you don't have to be at the end of your wit to ask for support. So anytime is okay, even if you're feeling okay. Where can people go? So there's a lot of clinics. I myself is in Mind Plus by Life Science. That's based in BGC. Of course, there are other clinics. You can find them in resources. DOH has a list of all accredited mental clinics. There's also referral systems like silakbo.ph/help that you can go to check which clinics might be near you. So one benefit of the pandemic is a lot of therapists have went online. So if you're feeling like, I don't want to meet anyone face-to-face yet, that's also an option. But as we move this pandemic along, we do expect that most therapists, most counselors, even psychiatrists, will return to a more hybrid setup where they'll have a face-to-face clinic for those that really need it.
Thank you very much, Dr. Aika Buenavista and AJ Sunglao, for being with us today and sharing your tips as well as your expertise about personal hygiene. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.